Okay, so in coloproctology is a usual. There are some conditions that the treatment for is quite painful, uncomfortable, and can lead to long recovery. Unfortunately, sometimes with some complication. So the idea to have the laser treatment, more specifically the laser ablation in for hemorrhoids, pilonidal sinus or anal fistula, is to have a mini invasive treatment where there is less pain post-operatively. Most of these patients have very minimal pain post-op. They can go home on the same day, and the risk of complication, specifically to damage the tissue surrounding the anus, causing, for example, incontinence or infection or postoperative bleeding, is very, very minimal. Essentially, in the literature, has been recorded as 0% of risk of complication. The laser ablation of the hemorrhoids is probably one of the best option to have non-painful treatment for the hemorrhoids. How the laser works is that the laser has a special probe from the hemorrhoidal therapy, which has a small spike at the beginning of at the tip of the probe. With this spike, we go inside the hemorrhoids and we do the ablation of the hemorrhoids from the inside. So the advantage of that is that we are essentially burning the hemorrhoidal tissue, the veins, from the inside without damaging the anoderma. The anoderma is important for the sensation around the anus, which helps in the function of the bowel, especially the continence. So the advantage of that is because the laser doesn't penetrate too far. So normally it's a matter of millimeter, less than 5 millimeter. So is less, there is less risk to cause damage in the surrounding structure, like for example the sphincter, and for example causing incontinence. And the other thing is that the reduction of the hemorrhoids following the ablation with the laser happens gradually. So immediately after surgery, there is a 30% reduction, but then there is another 30-40% which happens in the weeks post-operatively, where there is no pain. So there is more time for the anatomy to readapt, avoiding risk like leakage or, as I say, the fine incontinence to liquid and gas. And once again, as I say, the efficacy of the laser treatment in hemorrhoids is about 65%, but most of the time patients are very happy with the treatment because they experience no pain whatsoever, no pain going to the toilet, and even if there is a long-term need to do another session of laser, this can be done with a very, very minimum risk of causing other damage. But anyway, the first treatment is about 60% success rate with a risk of complication which is essentially close to zero. In my view, the laser ablation of the pilonidal sinus is probably one of the best application of the laser in coloproctology. So normally the pilonidal sinus, unfortunately, is very common in young patients, and despite it's something very simple, can change the quality of life dramatically because it makes it very difficult to sit. And there is always an open wound causing discharge and makes everything more difficult going out or some sport activity, for example. So the conventional treatment of the pilonidal sinus, which implies removing excise, so making a skin incision, removing the pilonidal sinus, and then close the skin, has a high risk of wound infection, breaking down of the wound, and then there is an open wound which takes sometimes several months to heal, and sometimes unfortunately does not heal. This is a very common complication of the pilonidal sinus surgery. So the laser treatment essentially can eliminate all of these. There is no excision of the pilonidal sinus. With the laser treatment, we destroy the pilonidal sinus from the inside. So we use the external opening to go in with a special laser probe. This time the laser probe is very smooth, the tip is very round and smooth, can go in easily without causing any damage, and the laser goes around the probe, destroying the tissue from the inside. These has a very high success rate, is about 87%. And once again, normally it works on just one session. And if it doesn't work, sometimes there is a very small sinus left behind, which is less than 5 millimeter, which can be treated with a laser, or sometimes just in clinic with a silver nitrate and during the follow-up in clinic without going back to theater. So the success rate, in my opinion, is even higher than 87%. And in terms of risk, essentially there are no risk. The laser is very much contained to the soft tissue around the sinus. It doesn't go any deeper. There is no risk to cause any open wound. Risk of infection is very minimal, 0% almost. The same thing about the risk of bleeding. The only thing I will add for the pilonidal sinus is that in some cases, for example, patients with diabetes or currently smoking, all those patients with high risk of infection, if during the first treatment there is a lot of infection, active infection with pus, sometimes we need to do this treatment in 2 steps. The first step is just the debridement and clearing of the sinus from the inside. Once again, no skin incision. I'm just making the external opening bigger. I'll use something to debride the sinus from the external opening. And sometimes we need to apply a acetone, which is like a thread which goes inside the sinus to allow these to clean over 4 or 6 weeks, and then we do the laser at the second session. It depends on the degree of infection, essentially. So the laser ablation of anal fistula, the success rate which has been recorded is about 80%. And once again, the risk of complication is very close to 0%. But again, the laser treatment offers the greatest advantage that we do not risk damaging the sphincter. So if you've got an anal fistula, you will know that the gold standard treatment of the anal fistula is a delay opening of the fistula, which means cutting through the skin, the soft tissue, and if the sphincter is involved, it means also cutting through the sphincter, sacrificing the sphincter. If, of course, this can be done when the amount of sphincter involved is very minimal. If there is too much of sphincter, the sphincter is the muscle around the back passage, which help with the continence. If there is too much of the damage of this muscle, then we risk incontinence. And the incontinence can be gross incontinence, which absolutely this cannot be accepted, but can also be the fine incontinence to liquid and wind. With the laser, we eliminated all this problem because, again, we're not destroying anything. We use the probe, which again is the one similar to the one used for the pilonidal sinus. It's very smooth. The tip is all round. It can slide inside the external opening, and then we do the ablation of the fistula from the inside. The laser is used a low power, so it doesn't go deep enough to cause damage of the sphincter. So these are the greatest advantage. So this is a very minimally invasive. Risk of complication is essentially 0. The only risk is that there is a 20% of cases, and there are some specific cases where the laser unfortunately doesn't close the fistula. But again, in some cases, patients prefer to have multiple sessions of laser ablation rather than having the acetone for the rest of their life, or having other procedure where they can risk pain, bleeding, or open wound and the damage of the sphincter. So that's, for me, is the greatest advantage. It doesn't cause any damage of the surrounding tissue. So in all these 3 conditions, the haemorrhoids, the pilonidal sinus, and the anal fistula, the treatment with the laser or the laser ablation of these three conditions has a very essentially zero risk of complication. If you look at the literature online, the risk of complication has been recorded as zero. The main risk, if you want, is the failure of treatment. But as I said, it is particularly good for all three. In common terms, we can say there is more chance to be effective than not to work, with a greater advantage that we don't cause any pain, don't cause any risk of bleeding. And the other thing probably we should add that we preserve the anatomy. For example, as I said, for the hemorrhoids, we don't remove the hemorrhoids. We preserve the function of the hemorrhoids. With the anal sphincter, with the anal fistula, we don't damage the anal sphincter. The risk of incontinence is zero. Specifically for anyone with pilonidal sinus and anyone with anal fistula, they can have laser treatment. As I said, it might be that we need to do this in more stage if there is a lot of infection. This is the same for the sinus and the same for the fistula. Technically speaking, the best effect is when the tract that we are going to ablate is about 5 centimeters or less, is relatively straight, and is quite narrow rather than too wide. So sometimes with the sinus and sometimes with the fistula, if we might need to do an initial procedure where we make the pilonidal sinus, the anal fistula optimize in view of the laser treatment done in the second session. Regarding the hemorrhoids, again, any type of hemorrhoids can be treated with ablation. It depends how much the external component is bothering you as a patient. Because if, for example, you've got a grade 4 hemorrhoids completely prolapsing, and the expectation is to completely get rid of them, then you might want to look at the traditional operation where we excise the hemorrhoids. But if the hemorrhoids is still a grade up to a grade 3, so where the prolapse comes and goes, it can be reduced spontaneously or manually. The manual reduction of the prolapse is the grade 3. These are the perfect target for the laser ablation. Of course, if you are a grade 4, the hemorrhoids are already outside, they can be treated with a laser, but some of the prolapse might persist without the bleeding, of course. But if the prolapse is the component externally is the one that the patient wants to get rid of, then maybe in that case we need to have a discussion on having the traditional surgical operation where we excise the hemorrhoids. But in principle, all 4 grades they can be treated with laser.